A Florida nurse attacked on the job, almost beaten to death. And it happens all the time.
He punched me in my face, and it took us a very long time to subdue him.
Nurses and hospital staff, targets of violence.
Things are not good.
Now, Not investigates Frontline Fears for medical workers. Why this is happening and what can be done to stop it. You know, they're there to save lives, and sometimes they have to save their own. 80% of Florida nurses say they have been targets of violence at work.
In a new survey, many say they just don't feel safe. 9 Investigates has been digging into this growing trend, and our Shannon Butler is joining us live here in the studio. Shannon, some nurses say they may have to quit out of fear.
Yeah, that national survey found that more than a third are thinking about leaving the job or have already left. We've heard from nurses who say they're afraid to go to work and they don't feel like their employers are listening.
I have been bitten, kicked, punched, spit on, urinated on.
Jana Price loved being a nurse, but in 2022, after a decade on the job, she gave up working in the ER for good. Not because she was tired or burned out, but because she was afraid.
The last attack I remember, when I walked out of the room, I was so angry. I came out crying, and the first thing that came out of my mouth was, I am sick of this. I'm so tired of this, because it was not the first time I had been assaulted, but it was going to be the last.
According to the police report, Arthur Brewington was admitted to the hospital under the Marchman Act, which provides for involuntary assessment of people impaired by substance abuse. The report says Brewington had been restrained in his bed, but on the way back from the bathroom, police say punched Jana in the face and bit another nurse.
Thought it was safe, and he got angry. He had a very specific look in his eye that he was angry, upset, and he was going to hurt me. We screamed for help for a very long time.
A survey done in 2023 by the largest nurses union in the nation shows nurses reported a recent increase of workplace violence. Of nearly 1,000 surveyed, 8 in 10 said they experienced at least one type of workplace violence in the year prior.
We were short-staffed, as always. Security was short-staffed. This is not anything specific for just this one hospital. This is the story in hospitals all across the nation right now.
The nurses surveyed called for a better system to track, report, and investigate violence inside hospitals and demanded better training in self-defense and how to deal with mentally ill or violent patients. The issue made national headlines when this nurse was brutally beaten by a patient at a West Palm Beach hospital. Workers protested, asking for more training, and signed a petition wanting more staffing, armed deputies in emergency rooms, and panic buttons. But Jana says the only way to truly protect the hospital staff is with legislation.
Things are not good. Employers are not doing what they need to do to protect nurses and other healthcare workers.
Joan Thompson assesses workplaces to help protect employees' health and safety. She's working with National Nurses United to support a federal bill. Thompson says it would address concerns like staffing and require hospitals to implement violence prevention plans.
They're focused on one thing, and that's their bottom line. That's a driving force for them. And it is unacceptable for them to put profit over patients and nurses.
This is just so frightening.
Awful.
These nurses are here to help all of us. And how is that nurse doing in West Palm Beach?
So it's day by day. She is making some little improvements, but the injuries, I think, they were much worse than even her family could imagine until they got there. She still can't open her eyes. She still can't kind of function on her own. We actually took this investigation and asked some questions, and that family reacted to what we found out. Listen to a little bit about what she said.
He literally broke every bone on the side of her face. When I saw her, she had swollen eyelids. Both eyes were swollen, black and blue, swelling all down the right side of her face. She wanted to be a nurse for so many years, and she went to nursing school while having 3 kids. It took her 8 years, but it was her dream, and she did not do all that work to be attacked and almost killed.
And this family now really leading the charge on making change for these nurses and other hospital workers. And that's what we're here to do. We're going to have her full interview tomorrow at 5 o'clock.
And there is little doubt, Shannon. I mean, you have done a great job on this story. There are stories that are untold.
Just since our promo ran, just to say that we were doing this story, nurses and hospital workers have been emailing me, saying this happened to me, this happened to me, and this happened to me. So it is quite widespread.
This was an issue, but now we know thanks to you.
All right. Yep.
All right.
We'll get something done. Thank you,
Thanks,
Shannon.
Shannon.
Great.